Hey, stress test was normal.
But his EKG was not normal.
Echo's normal.
2 for you, 1 for me. We need a tiebreaker.
Echo and stress test are more reliable.
Tilt table test.
Never works.
Bet you a week's clinic duty it does.
You're wrong.
You like this guy?
You always tell us our opinion of the patient's irrelevant.
Medically, it's irrelevant. It says something about you.
You figure anybody who gives a crap about people in Africa must be full of it?
Yes. There's an evolutionary imperative why we give a crap about our family and friends. And there's an evolutionary imperative why we don't give a crap about anybody else. If we loved all people indiscriminately, we couldn't function.
So the great humanitarian's as selfish as the rest of us.
Just not as honest about it.
Well, you also always tell us motives are irrelevant.
Dr. Charles, your heart's handling the changes in orientation just fine. No pauses on your EKG.
And House drives in for the layup and no rejected.
What does this knobby thing do?
Well, I'm within protocol range. You're not going to get a different result.
The way I figure it is, this could show you problems at 6. Imagine what it'll tell you if you crank it to 10.
House, is that you?
Does it go to 11?
Would you stop? You lost. I'm scheduled for clinic duty Thursday and Friday.
All right, I'm beginning to feel nauseous.
Would you turn the damn thing off before you break it?
Okay, I'm getting dizzy, I can't see, and I'm gonna pass out.
I win.
Those speeds astronauts throw up.
I'm not talking about the nausea.
The test revealed a problem.
Yeah? House is insane. What he just did.
Abusive and unprofessional. If he hadn't done it, we wouldn't have seen the problem. We've got an abnormal PR interval. Could be dangerous, possibly fatal, particularly if you're in Africa away from advanced medicine.
I'm gonna need a pacemaker.
We're scheduled for surgery this afternoon.
We'll be able to maintain your pacemaker from anywhere. Just need to get yourself to a phone line every few months.
Better yet, you could join me at one of my clinics.
I'm kind of spoiled.
Well, we get you a hut with a view you like seeing.
I meant medically. No PET scans, no MRIs.
It's ridiculous.
Dr. Charles,
I know. Hospital regulations. Darling, have a seat. Come on. You're smart. You'll adapt. We're going up or down.
Basement.
You might even find that without the technological crutches, you become a better diagnostician. My heart can handle this, right?
So far, just carnival rides have set you off.
When you meet these people, it changes you. We should talk about it over dinner.
Are you asking me to Africa or on a date?
Oh, I can ask you halfway around the world. I can't ask you to a restaurant a block away.
Well, one's a job and the other is...
Yeah, hospital regs, you can't take patients, right? I wouldn't want to risk your precious objectivity. You haven't answered either question, by the way.
You don't think objectivity is important?
I think doctors like House cling to objectivity like a 3-year-old to a blanket. Don't get too worked up. Stay calm. Stay cool, maintain the correct perspective. The only flaw in their argument is that when you have millions of people dying, the correct perspective is to be yelling at the top of your lungs. Sorry, my head is killing me.
Here, sit on the step.
So you gonna go out with me or not?
Your heart rate's normal.
Yeah, of course it is. It's 1 flight of stairs. I'm gonna be fine. Hands a little.
Call a code! 2nd floor stairwell! He asked me out.
I'm shocked. I'm shocked when patients don't ask you out.
He also asked me to come to Africa.
Boy, he moves fast.
I think the 2 questions had 2 different objectives.
You like him?
Good-looking single guy, genius doctor, cares about the world.
I take it you said no.
You think I'm that hung up on rules?
He's not House. There's nothing there.
Yeah, there is.
Did I ask you to plant a PBD?
It was positive. He's got TB.
Well, of course he's got TB. The guy's been in the jungle for 20 years. If you tested positive for pink eye, would you think that was his big problem?
I did a test. It was positive. Why is that a problem?
Because now he's got the big red target on his arm. The stubborn jerk thinks he's right. He won't let us do any more tests.
Well, maybe he's not the only stubborn jerk. I did an LP2, low glucose, and he has an increased SED rate. Everything screams tuberculosis.
Not everything.
If any of the symptoms are caused by the TB, it would throw off our diagnosis.
You're right. We gotta treat the TB.
Who knows? Maybe he'll just get better.
You'd like that, wouldn't you?